Hi, I'm Dr. Skene. I grew up in Orem, Utah, and I went to the University of Utah for my undergraduate work. I attended dental school at the University of Pennsylvania, and then I completed my 3-year residency in periodontics and implantology at the University of Pennsylvania as well. I've been practicing full-time periodontics in Salt Lake City since 2008. Many times when I meet new people, they ask me, what is a periodontist? And I tell them, well, I do 4 or 5 surgical procedures. I do gum grafts, I do implants, I do extractions and bone grafts, and I treat gum disease. So I really enjoy doing those things, and because that's all I do, I feel like my skill set has been developed so that I can be the best doctor I can be, and I can give optimal care to my patients, and I really enjoy that. I want to walk you through an orientation of what it's like to become a new patient in our office. First thing that we like to do is review your medical history, so make sure that you bring a list of your medications and then bring any pertinent information that we need to know to keep you healthy while we're working. I'd like to walk you through some of the instrumentation that I use to evaluate your gum health and to evaluate your bone. This is a periodontal probe. It has millimeter markings on it. I'm going to walk this below the gum line. It's kind of like putting it underneath your fingernail like this. So if it goes below the gum line 3 millimeters or less, that's considered healthy, because when you floss, that's how far floss can reach. If you have a pocket that's deeper than 3 millimeters, like a 5, that dark line, or above, then that means that the space is too big for floss, so it can't reach below the gum line. It traps and causes infection. I'm going to show you what it looks like to have the probe go below the gum line. This is your molar, and this is some gum tissue. So the probe is designed to slide gently below the gum line. We're trying to get an idea of how much bone loss you have. So when we slide this below the gum line and you see that dark mark, which is the 5 millimeter mark, go below the gum line, we know you have some bone loss. If it only goes a couple of millimeters below the gum line, like right here, 2 to 3 millimeters is considered normal. So you don't have bone loss and you won't need treatment in that area. While I'm calling out the numbers, the assistant will be putting them into the computer. Once the chart is established, I will sit you up and we will review the numbers together. Oftentimes, your dentist will send you to our office with a panoramic x-ray. These x-rays are a little bit fuzzy and they're difficult to read in terms of bone loss, so most likely we will take a periapical film. These periapical x-rays are very detailed images that we can look at to determine where the bone loss is around your teeth. Once we see these areas, I will draw you a diagram and show you specifically where the bone loss is inside your mouth. I will try to keep you as comfortable as possible during the probings, and I want to make sure that all of your questions are answered about your treatment plan during the consultation. I know some people are probably nervous about coming to the periodontist, but we want to try and make your experience as positive as possible. We're really excited to meet you, so don't be afraid. Just call us and we'll get you scheduled, and I can't wait to meet you.